PTCB Hero. Food and Drug Act of 1906 prohibits interstate commerce of misbranded and adulterated drugs and foods. Federal Food, Drug and Cosmetic Act of 1938 requires drug manufacturer to provide the FDA with evidence of safety when submitting a new drug. Durham-Humphrey Amendment of 1951 defines two specific categories for drug products: legend drugs or prescription only, and over-the-counter drugs. Legend drugs must indicate caution. Federal law prohibits dispensing without a prescription. Keith-Harris Amendment of 1962 requires drug manufacturers to scientifically prove that medication is not only safe but effective. Controlled Substances Act of 1970, CSA. The Controlled Substances Act is a federal drug policy that regulates the manufacture, importation, possession, and distribution of controlled substances. Controlled Substances Refills. Class 2 is not permitted. A new prescription must be issued for each refill. Class 3 and 4 prescriptions can have up to 5 refills or refills up to 6 months from the date of issuance, whichever comes first. Class 5 can be refilled as many times as authorized by the prescriber per federal law, but by state laws may differ. Controlled Substances Prescription Expiration. Class 2, no expiration per federal law, but may have an expiration date per state law. Class 3 and 4, valid for 6 months. Class 5, no expiration per federal law, but may have an expiration date per state law or company policy. Controlled Substances Prescription Partial Fills. Class 2 partial fills is permitted as long as the remainder fill is filled within the next 72 hours. Class 3 to 5 partial fills are permitted with no time limit as long as the prescription is not expired. Transferring controlled substances prescription for refill. Class 2 transfer prohibited. Class 3 to 5 allow one-time transfer between two pharmacies. Pharmacies electronically sharing in real-time online database may transfer up to a maximum refills permitted by the law by the prescriber. Maintenance of controlled substances records. Class 2 records must be stored separately from all other prescriptions. Class 3 to 5 records must be stored separately from other prescriptions or marked on the lower right corner with a letter C in red. Then may be stored in the same file with no controlled substances prescription records. Note: these record-keeping rules apply to hard copy prescriptions only. Electronic prescriptions may be stored in the readily retrievable electronic database. Maintenance of controlled substances inventory. Initial inventory. When issued the DEA registration, a pharmacy must take inventory every 6 months. Class 2 controlled substances inventory records must be separately filed from the Class 3 to 5. Class 1 products must be stored in a secure, lockable, sustainable cabinet, usually a safe or a vault. Class 2 to 5 must be stored in a lockable, substantially constructed cabinet, usually a safe or a vault. Distributing or receiving controlled substances. Form 41 for reporting the destruction of controlled substances. Form 104 for reporting pharmacy closure or surrender of a pharmacy permit. Form 106 for reporting loss or theft or controlled substances. Form 222 for ordering Control 1 and Control 2 substances. Form 222A for ordering more than Form DEA 222. Form 224 for applying for a DEA registration number. Form 2224A for a DEA registration renewal. A prescriber cannot legally prescribe a controlled substance unless are registered with a DEA. The prescriber must include the DEA number in the face of a prescription. DEA numbers have 2 letters followed by 7 numbers. The first letter identifies the practitioner. A, B, and F physicians, dentists, veterinarians, pharmacies, and hospitals. M, or mid-level, practitioners such as physician's assistants and nurse practitioner. P as in Peter and R as in Robert are manufacturers, distributors of narcotics, treatment programs, and researchers. The second letter represents the first letter of the prescriber's last name and the first letter of the business name of the hospital or the pharmacy. There are 4 steps to verify a DEA number. 1. Add the first, third, and fifth digits of the DEA number. 2. Add the second, fourth, and sixth digits of the DEA number. Then multiply the sum by 2. Add the results from step 1 and step 2 together. Then the sum from step 3 will be a 2-digit number. The second digit of that number will match the 7th of the final number. Exceptions: officials of the U.S. Air Force, Army, Navy, Marines, and Public Health Services are not required to register with DEA. Poison Prevention Packaging Act of 1970, or PPPA, aims to protect the children from poisoning death and can occur, requires over-the-counter and legend drugs to be packed in child-resistant containers. Federal Anti-Tampering Act of 1983 mandates that over-the-counter drugs products must have a tamper evidence seal. Sometimes called the Tylenol Act, it was passed in response to the death of 7 people who took Tylenol capsules that had been laced with cyanide in Chicago. Prescription Drug Marketing Act of 1987 prohibits the selling, purchasing, and trading of prescription drug samples, limits the prescription of drug samples only to those licensed to prescribe them if requested. Omnibus Budget Reconciliation Act of 1990, or OBRA 90, commonly known as OBRA 90. This act establishes that 3 key pharmacy provisions: drug utilization review, patient counseling standards, and patient record maintenance. Drug Utilization Review, or DUR, also known as the Drug Medication Utilization Evaluation. Dietary Supplement Health and Education Act of 1994. Under this act, dietary supplements such as vitamins and herbal supplements are considered food. Therefore, dietary supplements do not have to be approved or authorized for investigation in a new drug. Health Insurance Portability and Accountability Act, HIPAA, of 1996, limits the use and disclosure of protected health information, PHI, to the minimum necessary. Food and Drug Administration Modernization Act, FDAMA, of 1997. This act eliminates certain labeling requirements. For example, the statement "Caution, federal law prohibits dispensing without a prescription" may be stated as RX only. Drug Addiction Treatment Act, data of 2000, allows qualified prescriptions to complete and training and register for a narcotic addiction DEA number. Combat Methamphetamine Epidemic Act of 2005, or CMEA, regulates the sale over-the-counter product containing pseudoephedrine, PSE, and ephedrine, which can be used to manufacture meth. 2005 Combat Methamphetamine Epidemic Act establishes strict controls of over-the-counter sales of pseudoephedrine, ephedrine, and phenylpropylene. Daily 3.6 grams per day per customer. No more than 9 grams per 30 days if purchased in store. No more than 7.5 grams per 30 days if purchased via email or mobile retail vendor, i.e. airport kiosks. Practice questions. A prescription label states glipizide 5 mg tablet, take 1 tablet by mouth every day for breakfast for 30 days. The prescription bottle contains 30 tablets of glyburide 5 mg. If the label satisfies all of the federal and state requirements, this prescription label is considered A. adulterated, B. misbranded, C. adulterated and misbranded, or D. appropriate since the prescription correctly from the doctor's order. The prescription is both adulterated and misbranded. According to the Food and Drug Cosmetic Act, adulteration occurs when the product has been mixed or packed with any substances which requires its strength and quality. A drug is misbranded if the labeling is false and misleading. The label indicates that there are 30 tablets of glipizide, when in fact there are 30 tablets of glipizide 5 mg, which is false and misleading, of glyburide. The prescription is therefore both misbranded and misleading. Question 2. DEA Form 222 must be maintained, made available for inspection for A. 12 months, B. 2 years, C. 3 years, D. 5 years. According to the DEA, Form 222 must be maintained for 2 years. Question 3. Which of the following medication is not required to be dispensed in a child-resistant container? A. Hydrocodone or acetaminophen, B. Sublingual nitroglycerin, C. Ketorolac, or D. Zolpidem. The Poison Prevention Packaging Act of 1970 requires that most over-the-counter products used and legend drugs be packed with child-resistant containers. Some of the products that are exempt from the PPEPA are sublingual nitroglycerin, effervescent acetaminophen, effervescent aspirin, oral contraceptives, and hormone replacement therapy. So the answer is sublingual nitroglycerin. Question 4. A patient drops off a prescription for 30 Vyvanse's 30 mg capsules. The pharmacy only has 15 capsules in stock. The patient accepts a partial fill of 15 capsules. The pharmacy shall provide the patient with the remaining 15 capsules within A. 24 hours, B. 72 hours, C. 7 days, D. 10 days. The remaining portion of the prescription may be filled within 72 hours of the first partial filling. However, if the remaining portion cannot be filled within the next 72 hours, the pharmacy shall notify the prescriber. No further quantity may be supplied beyond 72 hours without a new prescription. Question 5. The Safety Data Sheet (SDS) is overseen by which of the following organizations? A. FDA, B. OSHA or OSHA, C. BOP, or D. the DEA. The SDS, formerly known as the MSDS or Material Safety Data Sheet, is overseen by the Occupational Safety and Health Administration, OSHA, or OSHA.